Hi, I'm Dr. Mike Milligan. I'm on the board with the American Academy for Oral Systemic Health, and I have Dr. Micheal Roizen with me. Michael, thanks so much for being with us.
Privilege, Mike.
You are the chairman of the Wellness Clinic at the Cleveland Clinic.
I'm the chair of the Wellness Institute and the chief wellness officer, yes.
Okay. And you've written the Real Age books, you've been on hundreds of TV shows, author internationally. Tell us a little bit about the Cleveland Clinic and the Wellness Institute here and the purpose and what that's all about in a nutshell.
The focus is what can we do optimally for the patient.
Okay.
And the clinic has been rated in the top 4 hospitals in the world by U.S. News and World Report for whatever it is, 18 years in a row, and number 1 in cardiac care.
In the world?
In the world,
wow.
For 18 years in a row.
Okay.
But the key thing is Dr. Cosgrove, our CEO, said if we're going to keep leading, we've got to do more than be great at patient care, education, research, which are the 3 legs of the classic 3-legged stool.
Right.
We've got to be, in fact, lead in wellness, because the only way the United States can lead in can be a viable country, really, is to decrease the burden of chronic disease.
Absolutely.
And to do that, we have to focus on wellness, and so that's why the Wellness Institute was born, and that's why we focused on the areas we have. Well, I think there are 2 key things that the dental group brings. One is that you're the army that can spread the word, because you see so many people.
Right.
Right, and it's not just here in Cleveland or around, but it's worldwide or nationwide.
So we can disseminate the information.
Right, and the second thing is because inflammation, whether caused by periodontal disease or caused by something else, is a key component of, if you will, adverse health effects or keeping inflammation at bay, whether through periodontal care or through other, if you will, the food choices, etc. That is a key component of keeping healthy.
Right.
So you represent, whether it is through toxicity of mercury or whether it is through inflammation in gum disease or tooth loss, you represent a huge component of what people can do to stay healthy, to stay young, and to keep vibrant.
Okay, well, thank you. So you mentioned 4 main things that people could do environmentally, themselves, not necessarily their genetics, but 4 things people could do to live longer. What were those 4 things?
The 4 things that are the major things in chronic disease are to avoid tobacco,
right,
and secondhand smoke, and all tobacco products, chewing, etc. is included in that.
Right.
Make the correct food choices and portion size.
Right.
That means not only to stay thin from not overeating, but it also means to choose foods that do not have added sugars, that don't have added syrups, that don't have simple carbohydrates, that don't have saturated fat, and don't have trans fat. Be physically active. Right. And the 4th is manage stress. Now, as I went through the list, if you will, so flossing and see a dental professional is 11 on the list of most important things. So it's in one of those. If you combine the food into one, it's actually in the top 10 list of the most important things that everyone can do to stay healthy. And that's because periodontal disease causes inflammation in the rest of the body, not just in the gums.
Okay, Dr. Roizen, thank you so much for being with us.
Thank you, Mike.
Okay.